Hello you guys, welcome back to my channel. If you're new here, my name is Safia. I've been a registered nurse for 8 years and now I'm a new nurse practitioner. Nursing school was very stressful, kind of traumatic. It's a lot of studying. During my last semester of nurse practitioner school, I started using this website that I wish I had when I was in nursing school. It is going to make your life so much easier in nursing school, so let's get into it. This website is called Picmonic. Literally anything that you need to know that's nursing related will be on this website. What makes it different from any other like nursing prep is that it uses videos. So if you're a visual learner, you can watch these videos and really retain the concepts that you're studying. And it gives you really fun like mnemonics to help you remember. They're short, they're concise, they're about 2 to 3 minute long videos, which would help you remember way faster than studying like a 40-page chapter on diabetes. I failed classes, I failed tests. So I'm gonna highlight all of the beneficial sections of this website and some of my favorite ones. There's a lot of courses that you need to take to get into nursing school. Nursing school is very competitive, so you really want to try your best on all of the prereq courses before applying to NP school, nursing school. The first prereq course that I took that was specific for nursing school was Human Anatomy and Physiology. Failed the HNP lab, I got a D. Had to repeat that class, which put me back a semester. It was serious and I did not take it seriously. I never studied, so that's why I failed. But it was a lot of information. You had to know literally everything about the human body. I wish I had Picmonic when I was taking my H&P course because I would have registered the information a little bit better. I don't do well with reading and remembering. Like I have to see it. Even with working as a nurse, like I have to see it. You're explaining something to me, I have to see it. Picmonic has an entire section of just strictly H&P. One of my midterms for the H&P lab was to identify the muscles in the legs. So they would have, you know, like a whole skeleton with all the muscles, and you had to identify whatever it is that they were pointing to. Personally, the thigh muscle was really hard for me. I feel like there's just so many muscles in your legs, but I'm going to show you guys how simple it is to just like identify landmarks in the body by using the Picmonic videos. Like to visually see rectus femoris, like right in the middle of the quad, and there's a bone that's surrounded by a rectangle. I would have remembered that. I think it's particularly helpful in Human Anatomy and Physiology is to actually see it versus reading it. Y'all know how expensive nursing school books are. My very first semester, after we did like the nursing orientation, we went into the bookstore and I spent like close to $1,000 on all of my books, everything that I needed. I still have my medical surgical book by Brunner that I just paid way too much money for. I wasn't gonna give it up, so I still have it. But Picmonic literally has Brunner like videos on their website, like all the topics that they cover in that book, that huge thick book. They have videos on it on their website, which is crazy. Let's talk about that infamous medication calculation test. I hated that. Like it gave me so much stress and anxiety. So in nursing school, they offer a medication calculation test where you have to know how to determine the dosage of a medication, converting like pounds to kilograms, vice versa, drip rates for IV fluids. They offer it probably the first semester of nursing school. For my school, it was a pass or fail. So if you failed that test, then you failed out of that semester and you had to repeat it for the next semester. You failed it again that following semester, then you're kicked out of nursing school. We had 2 attempts to take the test. I failed the first one and I was so distraught. Like I was crying, like I was so stressed out. I'm like, I hadn't even been in nursing school for a month and I'm almost done with it. Just doing a lot of just med-cal practice questions, and of course like I passed my second attempt. But I say that to say that Picmonic has a section specifically for med math, videos on how to convert, videos on calculating drip rates. So if med math is kind of a weak area for you, you can definitely watch videos to kind of refresh your knowledge and get you prepared to take that test. My third favorite section for nursing students and for like NP students is their pharmacology section. This is the section that I used specifically when I was prepping for my nurse practitioner boards, and I think it's really a good refresher for me before I start practice is to refresh my knowledge on medications, because now I'll be a prescriber. I literally had a question that was about a side effect to a medication, and I knew it because I watched this video. I won't say specifically what the question was because I don't know if I can do that, but just know that I watched one of the Picmonics and it said that side effect, and I knew exactly what the answer was when I was taking my boards. Pharmacology was very stressful in nursing school. Exam isn't just going to be on like antihypertensives. It's going to be on antihypertensives, antibiotics, psychiatric medications. Like, it's going to be multiple drug classes on one exam. Like, just starting out, you can watch a video on PPIs. Seeing that picture of the hip broken because it can cause osteoporosis with long time use. Like, those little things that you see that will help you remember. It helps me remember, at least. I'm going to go through the website just to show you guys how it's set up. I currently have the nurse practitioner version, but it's pretty similar to the nursing version. So it has a search tab on there and it'll pop up any kind of Picmonic that is related to that. Let's do beta blockers. You can see all the Picmonics that are related to beta blockers. Side effects, using it for social anxiety, you can use it for migraine headaches, all the things that are related to beta blockers, either 1 or 2. But if you want to look at beta blockers and how it's used as an antihypertensive, the pharmacology aspect of it, you can go to playlists and go to the pharmacology CV system, and it has all the information related to beta blockers. Let's do the selective beta blockers.
Depicted as the only beta 1 selective beta fish 1-1 with LOL blocks are medications that work to prevent the actions of epinephrine and norepinephrine on the heart. Remember that these medications typically start with a letter from A through M and end with the olol suffix, represented by the lolly. Two exceptions to this rule are the non-selective beta blockers carvedilol and labetalol. These medications are beta 1 selective, depicted as the selective beta 1 beta fish 1-1, and work to decrease heart rate, contractility, and renin release. Specific drugs in this class include atenolol, the entenolol, the short-acting drug esmolol, the esmolol, and metoprolol, the metoprolol. At high doses, some selective beta-1 blockers are also partial beta agonists, shown as the partial beta-fish dragonist, such as the drug acebutolol, the acebutolol. So remember, selective beta-1 blockers' generic names start with a letter from A through M and have the olol suffix. They selectively block beta-1 adrenergic receptors and include the drugs atenolol, esmolol, and metoprolol. Some beta-1 blockers also have beta agonist activity at high doses, such as the drug acebutolol.
If you scroll down after watching the Picmonic, you'll see more information. Sometimes they have cute little pictures like this, where it'll give you kind of like a little mnemonic to remember. So like for this one, the alpha-1 blockers, the OSINs, like ocean, or the beta blockers, LOL. They have a LOL on a lollipop. I hope this video has been helpful. Honestly, I truly believe that Picmonic is a great resource if you're a pre-nursing student, or if you're a nursing student, or even if you're a nurse practitioner student. I really think that watching these videos would be helpful to learning everything that we need to know to be a nurse. I do have a promo code in my bio where you can get 20% off. I hope that you guys trial it and see if you like it. It's been really beneficial for me, like preparing for my nurse practitioner boards. So I hope that it helps you as well. I really think that it will. Just watching the videos, it'll just make nursing school a whole lot simpler and easier. Thank you guys so much for watching. If you have any questions, leave any comments below, and I'll see y'all in my next one.